Hi, this is Dr. Darren Schmidt at the Nutritional Healing Center in Ann Arbor, and this video is on your diet should prevent heart disease and cancer. This is an interesting topic. So I'm going to talk about these people. We have Dr. Pritikin, Ann Louise Gittleman, Dr. Atkins, Thomas Seyfried, Dr. Pompa, Dr. Mercola, Dr. D'Agostino, Otto Warburg, and then Dr. Royal Lee. So these are the people that we're going to talk about regarding this subject. So Dr. Pritikin was a low-fat vegetarian medical doctor. He started his crusade in 1955, somewhere around there. He died in 1985. And the reason why he died is because he had cancer. He actually had 2 leukemias, and he agreed to go through chemotherapy, and it caused tremendous pain in his body, which is lactic acidosis. I have videos on lactic acidosis. And the pain was so bad that he actually committed suicide. They did an autopsy, and there was a resident heart surgeon who was in the morgue, and occasionally they'll do this. They'll have surgeon come in and practice. So the heart surgeon took out Dr. Pritikin's heart and was slicing it up. But the assessment is he had a very healthy heart and arteries. But the problem is he died from cancer. Well, he had cancer. So his diet, which was low-fat vegetarian, did not prevent cancer. Okay, now Ann Louise Gittleman worked with Dr. Pritikin in his office, and she left because she knew that, in his thousands of patients, he wasn't getting the results that she expected. So she is more of an advocate of low carb as opposed to high fiber, vegetarian, low fat. So she's more low carb, higher healthy fat. And she's got some great books that you can buy, and she's a very smart woman and very observant, so I appreciate people like her. So let's talk about Dr. Atkins. He has 80,000 people in his history that he helped personally in his clinic by doing his low-carb diet. And so when I say helped, we're talking about heart disease. He reversed heart disease, and at some point he came to the conclusion that if he puts people into ketosis, which means burning fat, he should be able to reverse cancer. So he opened up a clinic, and he asked a guy named Dr. Nick Gonzalez to run the cancer clinic. And Dr. Gonzalez said, no, thank you. But he did keep track of what happened with his clinic. So there's a video on YouTube where Dr. Gonzalez is talking about Dr. Atkins' cancer clinic. He's putting people into ketosis, meaning fat burning, reducing their sugar intake down to minimal, and after 2 years, Dr. Atkins closed his cancer clinic. So Dr. Atkins' diet did not reverse cancer. Neither did Dr. Pritikin's diet. Okay, but Dr. Atkins, we know for a fact, helped people with heart disease. And then Dr. Pritikin, I don't know about his results. I'm sure he helped some people with heart disease, but it wasn't enough to keep Ann Louise Gittleman happy as an employee in his office. So, but neither one of them reversed or prevented cancer, okay, or reversed cancer. Now let's talk about these people. Thomas Seyfried, he put out a book in 2012 called Cancer as a Metabolic Disease. And in that book, what he knows is, and what he teaches, is that you have to have true ketosis, meaning you have to measure the ketones in the blood related to the sugar. And the ketones need to be lower than the sugar. That's true ketosis. Now, back in the Atkins era, they didn't do blood work to find ketosis. They checked urine. They used what's called a keto sticks. So you can have sugar up here and ketones here, and then going on a low-carb, higher-fat diet like Atkins says, your ketones can come up, your blood sugar can come down, but the ketones are still lower than sugar. That's not true ketosis. These need to cross. Once that crosses, then you're in true ketosis. So this is more modern knowledge. So Thomas Seyfried wrote about this in this book and has over 1,000 research articles to back it up. And then we have drpompa.com. He teaches this to holistic doctors. Dr. Mercola, he teaches it on his website. Dr. D'Agostino, he's big into researching for ketones and ketosis. And these people have demonstrated exceptional health and endurance and brain power in themselves and in their patients. Now, when you're burning fat, you're burning ketones, you're turning off the cancer genes. You're actually killing cancer cells and turning off cancer genes. When you're burning sugar, you're turning on cancer genes and heart disease genes and diabetes genes. Okay, so now I'm going to talk about this guy, Otto Warburg. He's the guy that came up with the original idea that cancer is a metabolic disease. And this was in the 1920s. He won the Nobel Prize for it. And he also knew that it's not just about eating higher fat and less sugar. He also knew that there was toxicity involved, dysregulating the mechanics of energy production in the cell. And then we have this guy, Dr. Royal Lee, and he figured out lactic acidosis, and he taught about feeding the liver B vitamins. I have plenty of videos on this. But he's the guy that figured this out and wrote articles on it in 1958, 1959. And then he was squashed by the FDA in the 1960s, and he died in 1967. So what Dr. Pritikin and Dr. Atkins were missing was true ketosis is what kills cancer cells. And then true ketosis is only discovered through blood work. And I have a meter. I'm going to write this down for you. It's called the Precision Xtra. You can buy this on Amazon for $25. It's spelled XTRA, Precision Xtra. And it measures both glucose with one type of a stick that you put in there, and you put the blood on the stick. And then there's another stick you put in there, which measures ketones. The ketone stick for this machine is like $6. And the glucose stick is, pennies. But anyways, the machine itself, $25. You can buy it yourself, and you got to look online to learn how to do it. And there's some equations that you have to do, some math you have to do to get a specific number. But I'm just going to leave it at that and talk about, this is about the history of various doctors and how they missed the boat. But we know it now because we have the technology and the research to back up fasting and true ketosis to prevent cancer and heart disease at the same time and reverse it.